symptom, and you have to give a few options to the patients so that they can describe. So if it is Natramure, you will say like, okay, does it crumble? Does the stool crumble? And sometimes we may ask them, is the stool like burnt stool, or is it hard and large, or is it hard and slender? Is it hard and small balls? So these are the ways. And are these balls tied by mucus threads? So these are different remedies, right? So if it is balls, hard balls, we have sheepdung kind of stool. So many remedies are there, from opium to sepia, and in between we have smaller remedies also, like hydrastis and chelidonium. All these medicines have this sheepdung kind of a stool. Sometimes there is this shy stool of Cilicia. The stool goes and just comes back again, like it's shy to go out. And then we have this muriaticum stool, Natramure, Magmure, and all those medicines have it. It will just become crumbled after it comes out. And then we have this phosphorus slender stool, which is dry and slender, like dog stool, dry, black, slender. And then we have dry, burnt, large, very difficult stool, very hard stool, painful, like bryonia. So, and sulfur also has that kind of a stool. So we need to differentiate between all those medicines. No remedy has a richer array of stool symptoms, and as we see by the above few selected ones, some of them are very unique and have often been verified. It will repay any physician to carefully and frequently look them over. This remedy powerfully excites the sexual appetite in both sexes. It is almost irresistible and leads the patient into a mania in which he will expose himself. This is succeeded by the opposite extreme of impotence, though the desire remains after the ability to perform is gone. Of course, these sexual symptoms are accompanied with concomitant symptoms of the drug. Upon the female sexual organs, phosphorus is true to its general hemorrhagic tendencies. Now, so as I said, erectile dysfunction and impotence could be due to diabetes, and phosphorus is very useful. We need to know what all symptoms we need to look for when we are talking about these symptoms. So sometimes the erection lasts for a very small time. Sometimes the penis becomes it just loses power and contracts with when during the act. So there are many things. This we have to look at the repertory for the rest of the symptoms to see how we can distinguish between these remedies. If the menses do not appear, there is often vicarious bleeding from the nose or lungs instead. Phosphorus is bound to bleed. It is so with cancer of the womb or breast also. They bleed easily. Upon the respiratory organs also, this is one of our greatest remedies. And we know bright red blood. Phosphorus is associated with bright red blood. So if there is hemorrhoids or piles, bright red blood indicates phosphorus. Upon the respiratory organs also, this is one of our greatest remedies. Beginning with the voice and larynx, it causes and cures great hoarseness of voice. Patients can hardly make a loud noise and is apt to be worse in the evening or forepart of the night. There is pain in the larynx, worse by talking, or can't talk at all on account of it. I believe, I do not know whether ex-chief minister Vanchandi got phosphorus, but he is a typical phosphorus. If you look at the way he used to behave with people, he was always available for people, always sympathetic, compassionate, and always with people. And then if you look at the kind of symptoms that he had towards the end of his life, like the hoarseness and pain and things related to larynx and even cancer, I believe phosphorus would have been a very suitable remedy for him. We do not know the rest of the symptoms, but I'm just guessing. There is pain in the larynx worse by talking or can't talk at all on account of it. In croup, it sometimes comes in after aconite and spongia have failed. So we have this very dry cough of spongia. Aconite also has a dry, barking cough. And sometimes in these throat conditions, we give aconite to begin with because of the barking cough, dry cough, and aggravated by cold wind. And aconite doesn't help. At the beginning of an inflammation, aconite is useful with all the fear and anxiety that the patient feels, with the chilliness. And if aconite doesn't relieve, we give spongia. Usually spongia comes next in our order of prescribing. The way symptoms develop, that's what happens, and the cough becomes a little deeper, and it sounds like a saw driven through the pine board. That is the characteristic cough of spongia. And when you hear the sound, it's spongia. But then you have to verify the symptoms, and the patient would be hot by now, like aggravated by cold winds. But still, the patient would desire a fan, or would not like warm weather or warm conditions. So then you prescribe spongia, and spongia fails. In such cases, phosphorus might be useful. The disease has progressed downward until it involves the bronchi and parenchyma of the lungs. It is of indispensable value here. And also when, after the violence of the affection seems to have abated, the patient hoarses up every evening and seems to be inclined to relapse. Every evening the hoarseness would return for some time, and the patient is worse while talking, and they have to clear the throat of a little mucus like this. In bronchitis, the cough is tight, worse from evening to midnight, also from speaking, laughing, reading aloud, cold, and lying on left side. Cough is worse from evening to midnight. So it's the evening time that's a bad time for phosphorus patients and for pulsatilla patients. If you have a patient whose conditions like respiratory conditions are aggravated during the morning time, it is better to not think of phosphorus. Which are the morning time medicines? We know natrum sulf, hepar sulf, nux vomica, and many others, sulfur, many others come in the morning time. Calicarb, calibic. But if the patient's symptoms are aggravated or increasing, the respiratory symptoms are increasing towards the evening, think of phosphorus, pulsatilla, and those kind of medicines. Even lycopodium. And the rest of the symptoms would help us to decide. In bronchitis, the cough is tight, worse from evening to midnight, also from speaking, laughing, reading aloud. See, any exertion of these regions, speaking, laughing, reading aloud, all these things, and lying on left side, and cold, increase the cough. Now, worse from speaking, laughing, reading aloud, argentum metallicum. Remember argentum metallicum. So the patient is a very nervous patient. Argentum metallicum and argentum nitricum also is a very nervous patient. And when they are singing, sometimes the voice comes double, sometimes the voice misbehaves, and these people want to sing. Sometimes they lose their voice. They have all kinds of trouble from speaking, laughing, singing. And the sputum is like boiled starch, or like the white of an egg. That is argentum metallicum. But we are talking about phosphorus here. And phosphorus, when the condition progresses and becomes a bronchitis, like infection of the bronchus or the lungs, then we would see it would be mostly worse lying on the left side. Now, think about this, by lying on the left side, the condition aggravates. But you will find the pathology usually in the right lower lobe of the lung. And it may be because this movement of the fluid is taking place towards the left side, and that is what is causing the problem. Speaking, laughing, reading aloud, and cold weather all increase the cough. The patient suppresses the cough with a moan just as long as he can because it hurts him so. The whole body trembles with cough. We've seen these old tricycle subjects, the whole body will tremble with cough. And we can think about these tall, slender, tricycle or tubercular patients, usually they become weak and they become emaciated. Even diabetes patients, we classify diabetes mellitus under the tubercular miasm, perhaps because of this, because there is a psoric and a syphilitic element to it, and the patient becomes emaciated, thin, but is very oversensitive to any external impression, like cold or noise or smell or anything. So oversensitiveness could be attributed to the psoric element and the emaciation to the destructive syphilitic element. So here we see that in all the patients, they suppress the cough because coughing hurts them and the whole body trembles with the cough. It can happen to younger subjects also, but I'm giving you a typical case. It has great oppression of breathing in both acute and chronic affections of the lungs. There is heaviness as of a weight on the chest. Now, this is the opposite of emptiness. So, as I said, phosphorus has emptiness in the head, emptiness in the chest, emptiness in the abdomen, in the stomach. Every area feels empty. The empty sensation is there. All gone sensation is there. But here, sometimes they may feel heaviness and weight on the chest. In pneumonia, for which phosphorus is one of our best remedies, it attacks by preferring the lower half of the right lung. Remember, it is the right lung that is affected, not the left side, the right lung. Phosphorus is a left-sided remedy, and usually lying on the left side increases all its complaints, but it's the lower half of the right lung that is affected. It is apt to be indicated by the symptoms either at the beginning of the stage of hepatization, when it puts a stop to a further progress of the disease, but its more frequent application comes in where the stage of hepatization is past and we want to break it up and promote absorption or resolution. Here it has no equal. Phosphorus, calicarb, and all those medicines are useful during this stage. It is basically, there are structural changes happening and your superficial medicines are not going to help. Tinctures are not going to help. You need to find deep acting medicine, and that is when you turn to phosphorus, calicarb, sometimes to lycopodium, depending upon the patient's picture or the totality of symptoms. Here it has no equal, as I am fully convinced by abundant experience. Now, do not misunderstand and give the remedy blindly on a pathological indication only. If you do, you will sometimes fail and ought to. But I repeat, this remedy will oftener be found the indicated one here than any other. After the hepatization begins to break up, other remedies like tartar, emetic, sulfur, lycopodium will come in. So he's describing that particular disease in stages, and he says that after the hepatization begins to break up, you would need antium tart, sulfur, and lycopodium. But before or when this is happening, and if you want to stop it from happening, then you need to think of phosphorus. So it's like some of the medicines, they help to void the mucus. Some of the medicines, they help in such a way that the mucus is not produced or the inflammation is controlled beforehand. So here we have phosphorus, which would promote absorption or resolution, like mercury, phosphorus. These kind of medicines, they promote absorption or resolution. And then we have sulfur and lycopodium, which are useful if the next stage has come and we want the patient to expel all the mucus and be healed. In pleuritis, you will find stitches in the left side increased by lying upon the left side. Remember, in both affections, phosphorus is characteristically increased by lying upon the left side. So, stitches in the left side increased by lying on the left side. Stitches left side, again bryonia in pleuritis. Aggravation motion, bryonia. And there is calicarb also with